First, let's start with the temporalis muscle. Now, in case of temporalis muscle, from where it is, previously I have shown the diagram of the masseter muscle, okay, and I was explaining about the temporalis muscle. Very sorry. Now, this is the temporalis muscle. So, what is the origin of the temporalis muscle? As I have mentioned, it is from the floor of the temporal fossa. Okay, floor of the temporal fossa and temporal fascia. Okay, floor of the temporal fossa and temporal fascia. And if you see the insertion, okay, insertion is on the coronoid process, okay, an interior border of the ramus of the mandible. Okay, so this is the ramus, already I have shown you. This is the ramus of the mandible. तो ये देखो interior border में coronoid process. This is the coronoid process. This is the head of the mandible. ठीक है, तो coronoid process and on the interior border of the ramus of the mandible. Okay, so that is the insertion. Now, nerve supply तो एक ही है, mandibular division of the trigeminal nerve. Now, what about the function or action of the temporalis muscle? क्या action हो सकता है temporalis muscle का? Because see, it is coming from above. Where is the TM joint? ये देखो यहाँ पे TM joint है, but जो muscle है ऊपर से आ रहा है. तो what do you think when the fibers will contract, what it will do? Yes, yes, very good. It will elevate the mandible. ऊपर से आ रहा है, ठीक है? तो ऊपर से ऐसे contract करेगा, तो it will elevate the mandible. Now please keep that in mind. जितना भी muscles of mastication है, among them most of them are acting as elevation of the mandible except the lateral pterygoid, which helps in depressing the mandible. ठीक है? All of them helps in elevating the mandible. Only one, that is the lateral pterygoid, which helps in depressing the mandible. Okay. Now, if you see elevation of the mandible mainly done by the anterior and the middle fibers, anterior and middle fibers will elevate the mandible. Okay. Now, posterior fibers are also there. Now, this posterior fibers helps in retraction of the mandible. We know that protraction is there and retraction is there of the TM joint. In the movements of the TM joint, I have mentioned protraction is there and retraction is there. ठीक है? तो protraction suppose हो गया है, इसके बाद retraction कैसे होगा? That is done by the posterior fibers of the temporalis muscle. Okay? So that is the functions of the or actions of the temporalis muscle. What is the next? Next is the medial pterygoid muscle. Now please keep that in mind. जो medial pterygoid muscle है उसका दो head होता है, superficial head and deep head. As you can see in the diagram, this is the deep head and this is the superficial head. If you see the superficial head, it arises from the maxillary tuberosity. So when you will study the skull, you will study maxilla. That time you will come to know about the maxillary tuberosity. ठीक है? तो जो superficial head it arises from the maxillary tuberosity, and here you can see the deep head arises from the lateral pterygoid plate. Okay, that also from the medial surface of the lateral pterygoid plate. That is the origin of the deep head. तो दो head होता है, एक superficial head and एक deep head. And if you see the shape of the muscle, it is quadrilateral shaped. ठीक है? This is the medial pterygoid muscle. Next, what is the insertion? Medial pterygoid muscle. Medial surface of the angle adjoining the ramus of the mandible. As you can see, medial surface of the mandible, angle of the mandible and adjoining part of the ramus of the mandible. That is the insertion, okay, of the medial pterygoid muscle. Now what do you think, what will be the function of the medial pterygoid? As I said, जितना भी muscle except lateral pterygoid, you can write it for elevation of the mandible. ठीक है? So this is also helping in elevating the mandible. And along with that, one extra function is there, that is the protraction. Okay, ये जो protraction होता है, that is done by the medial pterygoid muscle. Okay. Next is the masseter and lateral pterygoid muscle. Now if you see the masseter, again it is quadrilateral shaped. Now what is the origin of the masseter? The zygomatic arch and the maxillary process of zygomatic bone, that is the origin of the masseter muscle. And here you can see on the lateral aspect of the ramus and coronoid process of the mandible, that is the insertion of masseter muscle. Okay, nerve supply same, trigeminal nerve, mandibular division of the trigeminal nerve. Now here what masseter will do, again it helps in the elevation of the mandible. Okay, and also helps in occlusion of the teeth for forceful bite. That is the function of the masseter muscle. Okay. Lastly, which muscle is this? Lateral pterygoid muscle. Now, we have to focus more on the lateral pterygoid muscle because this is the key region of this particular area, lateral pterygoid muscle. ठीक है? Now if you see the lateral pterygoid muscle, it is short, thick and conical shaped. शॉर्ट होता है, थिक होता है, कोनिकल शेपेड होता है, एज यू कैन सी कोनिकल शेपेड होता है. नाउ इसका दो हेड है, अपर हेड एंड लोअर हेड, एंड दोनों हेड के बीच में एक स्मॉल गैप रहता है, एंड दैट गैप इज वेरी इंपॉर्टेंट. कैन यू गेस व्हाई दिस गैप इज वेरी इंपॉर्टेंट? A very important artery is passing through this gap, and that is the maxillary artery. Maxillary artery. Okay, that's why this muscle is very important, key muscle. So if you have to understand this particular area, okay, then what you have to do, you have to study this muscle, because ये muscle का जो relations होगा, that will help you to understand the structures, how they are placed in that particular area. That's why lateral pterygoid is very important. So in case of lateral pterygoid, two heads are there, as you can see, upper head and this is the lower head. So upper head का origin mostly from the greater wing of the sphenoid, that also infratemporal surface and infratemporal crest of the greater wing of the sphenoid bone. Okay, and if you see the lower head, that is from the lateral surface of the lateral pterygoid plate. Okay, and after that both the head, where they will insert in the articular disc and articular capsule of the TM joint. Okay, now if you remember the TM joint which we have studied last time, okay, I have mentioned that जो articular disc होता है, okay, anteriorly it is continuous with the tendon of lateral pterygoid muscle, and as you can see over here, ठीक है, तो articular disc है and articular capsule के साथ जाके इंसर्ट होता है दिस lateral pterygoid muscle. Okay, next this lateral pterygoid muscle is also inserted on the anterior surface of the neck of the mandible. So one pterygoid phobia is there. ये देखो एक depression रहता है जिसको pterygoid phobia, okay, which is present on the anterior surface of the neck of the mandible. वहाँ पे भी attach होता है, and then another attachment is on the disc and articular capsule of the TM joint. ठीक है, so that is the origin and insertion of lateral pterygoid muscle. Now what do you think, what will be the function of lateral pterygoid muscle? Depression of the mandible. Okay, जितना भी muscle था, we have seen that elevates the mandible. Okay, and in case of medial pterygoid we have seen the protraction. Now here it depresses the mandible, and along with that the lateral pterygoid muscle also helps in protraction. Okay, जो mandible का protraction होगा उसमें भी help करता है. ठीक है, so these are some important functions of the muscles of mastication. Okay, now we'll see further details about the lateral pterygoid muscle. Now lateral pterygoid muscle, as I have mentioned, it is referred as the key muscle of this particular region. Okay, why? Because relations of this provide a fair idea about the layout of the structures which are present in that particular area. Okay, area in the sense in the infratemporal fossa. तो इतना देर से मैं area और region बोल रहा हूँ. What is the meaning of that? Meaning is in case of infratemporal fossa. ठीक है. Now I don't know whether you have noticed or not. ये जो head and neck region है, उसमें most of the areas you will be getting one key muscle. Okay, I don't know whether you have observed that or not. In most of the regions you will be getting one key muscle. Okay, and that is the most important muscle of that particular region. Now in this case, this is the lateral pterygoid muscle, because most of the structures are placed in relation with this particular muscle. For example, some muscles will be placed superficial to that, some muscles will be placed deep to the muscle. Okay, some structures will be placed deep to the muscle. So like this the structures are placed. Okay, that's why this is the most important muscle of that region. Now though it is very important, so there will be some relations also. So we'll start with the superficial relation. तो where is the lateral pterygoid? This is the lateral pterygoid. ठीक है, तो उसके सामने जितना भी रहेगा, मीन्स superficially जितना भी structure रहेगा, तो most of the structures can be seen over here. For example, see if masseter is going like this, so it will be superficial to the lateral pterygoid. Okay, then tendon of the temporalis also, so it will be superficial. Okay, then superficial head of medial pterygoid muscle. Okay, and from here you will be getting one artery that is called as maxillary artery. Okay, it is not shown but ऐसे जाएगा, that is the maxillary artery, which we will discuss about the maxillary artery also. Next, here you can see some other relations. See, this is the maxillary artery. Can you see? तो ये lateral pterygoid muscle है, ठीक है, दो हेड है, दिस इज द अपर हेड एंड दिस इज द लोअर हेड ऑफ द lateral pterygoid muscle, ठीक है. Now can you see a gap in between the two heads? Now through this gap you can see the artery is passing. Okay, which artery? Maxillary artery. Now here you can compare this maxillary artery with the axillary artery. Do you remember the axillary artery in upper limb which you have studied? First part, second part, third part. Here also same thing, first part, second part, third part. Okay, so compare it like this and then study, it will be easy. Now if you see other relations if you see other relations, so deep relations are there. Deep relation में mandibular nerve रहेगा. Okay, then you can see middle meningeal artery is there. Okay, then deep head of the medial pterygoid muscles. Okay, so this diagram is showing the deep relations of the lateral pterygoid muscle. Now there are some structure emerging at the upper border. So this is the upper border. So here you can see deep temporal nerves are there. Deep temporal vessels and nerves you can see which is emerging at the upper border of the lateral pterygoid. ठीक है. Now here you can see some structures emerging at the lower border. तो lower border में inferior alveolar nerve. Okay. Then you can see lingual nerve. So these are the structures which are emerging at the lower border. Next structure passing in between the two heads, the most important one is the maxillary artery and the buccal nerve. Okay, so these are some structures, as you can see, important structures passing in between the two heads, emerging at the upper border, emerging at the lower border. Some structures are superficial, some structures are deep to the muscle. Okay, next the maxillary artery. So the maxillary artery is one of the larger terminal branch of external carotid artery. ठीक है, if you see the origin of the maxillary artery, it is behind the neck of the mandible. Just see the diagram. Can you see? ये देखो, this is the neck of the mandible. ये head of the mandible है, and this is the neck of the mandible. तो you can see the origin of the maxillary artery. ठीक है, तो जो एक्सटर्नल कैरोटिड आर्टरी है उसका जो दो टर्मिनल ब्रांच होता है, इट इज सुपरफिशियल टेम्पोरल एंड मैक्सिलरी आर्टरी. सो इट इज वन ऑफ द लार्जर टर्मिनल ब्रांच ऑफ द एक्सटर्नल कैरोटिड आर्टरी. ओरिजिन कहाँ पे होता है? बिहाइंड द नेक ऑफ द मैंडिबल. ओके, बिहाइंड द नेक ऑफ द मैंडिबल. नाउ इन डिसेक्शन क्लास, कैन यू टेल मी व्हाई यू हैव नॉट सीन द मैक्सिलरी आर्टरी येट? Because we have not removed the ramus of the mandible. Okay, for that what we have to do? We have to remove the ramus of the mandible. Then only you can reach the infratemporal fossa. ठीक है, and then you can see the structures which are present in the infratemporal fossa. So mostly ramus of the mandible, why it is not removed? Because we have to preserve the parotid gland. Okay, now first you have to see the parotid gland. Parotid gland में in dissection class the most important thing which you can see is the duct of the parotid gland. That day I think I have shown you the duct. Okay, I have shown you the duct, and then you have to see the branches, terminal branches of the facial nerve. These are the two important things which you have to see in the parotid gland. Once this is done, then we can remove the ramus of the mandible. एक बार ramus of the mandible remove हो गया, then we can enter the infratemporal fossa. ठीक है, इसके बाद ये जो मसल्स ऑफ मेस्टिकेशन ऑलमोस्ट सब दिखाई देगा. तो आफ्टर ओरिजिन यू कैन सी इट इज गोइंग अपवर्ड फॉरवर्ड, crosses the lower head of the lateral pterygoid. Okay, and after emerging between the two heads of the lateral pterygoid, it enters the pterygopalatine fossa. How it will enter? Through pterygomaxillary fissure. तो यहाँ पे ये देखो pterygomaxillary fissure है. After crossing the pterygomaxillary fissure, it will enter the pterygopalatine fossa. Okay, if you have not studied, I don't know whether you have studied or not, please study the pterygopalatine fossa. Important है. Okay, location is very important. And the structures also. I hope that the sir has explained about the pterygopalatine fossa. Okay, now once it reaches the pterygopalatine fossa, then it gives some terminal branches and it terminates in the pterygopalatine fossa. Okay, now this maxillary artery is having wide area of distribution. ये जो maxillary artery है, as I said, it is one of the largest branch of external carotid artery and it is having wide area of distribution. Now what are the areas supplied by the maxillary artery? As you can see, upper and lower jaw. Okay, both upper and lower jaw. Then muscles of the temporal, infratemporal fossa, nose and paranasal air sinuses. Okay, then palate and root of the pharynx, external and middle ear, pharyngotympanic tube and dura mater. So these are the areas supplied by the maxillary artery. Okay. Now in case of maxillary artery, you must know that the maxillary artery is being divided into three parts. Okay, first part, second part, third part by the lower head of the lateral pterygoid muscle. Okay, lower head of the lateral pterygoid muscle. Now here you can see the diagram. ये देखो. So this is the upper head of the lateral pterygoid muscle. This is the lower head of the lateral pterygoid muscle. ठीक है. Now in between these two, can you see the maxillary artery is going? Now this particular head divides the artery into three parts. That's why I told you. Please compare it with the axillary artery. उसका भी तीन part था. First, second, third. इसका भी देखो तीन part है. First, second, third. Okay. So here you can see the first part, second part and third part. And based on that branches are different. ठीक है. So from where to where the first part is extending up to origin. Okay, from the origin or from the beginning to the lower border of the lateral pterygoid muscle. ये origin हो रहा है यहाँ से to the lower border of the lateral pterygoid muscle. This is the first part. Okay. Now this first part is accompanied by a very important nerve that is called as auriculotemporal nerve. Okay. Next is the second part from the lower border. Okay, from the lower border of the lower head of lateral pterygoid muscle to the upper border of the lower head of the lateral pterygoid muscle. That is the extent of the second part. And ये superficially जा रहा है. And after that, from the upper border of the lower head of the lateral pterygoid muscle to the pterygomaxillary fissure. From there, it will enter the pterygopalatine fossa. जहाँ पे terminate हो जाएगा. Okay, so that is the third part. So three different parts and from three different parts, different branches are arising. Okay. Now how to remember the branches, because so many branches are there. So the best way is, one formula is there, 5 4 6. 5 4 6. यहाँ पे लिखना है 5, यहाँ पे लिखना है 4 और यहाँ पे लिखना है 6. तो टोटल कितना branches हुआ? 5 4 6. 15 branches. ठीक है. So total 15 branches are there for maxillary artery. 5 4 6. Here you can see the branches. Okay. And one of the important terminal branch is the sphenopalatine artery. Now here you can see, as I said, 5 4 6. तो first part, second part, third part, 5 4 6. तो first part का 5 branches है. ठीक है. सेकेंड पार्ट का 4 ब्रांचेस, थर्ड पार्ट का 6 ब्रांचेस. ठीक है. नाउ हियर यू हैव टू नोटिस वन थिंग. ये जो ब्रांचेस है, नाउ अमंग देम ये जो मिडिल मेनिंजियल आर्टरी है, दिस इज हैविंग ए ग्रेट क्लिनिकल सिग्निफिकेंस एंड फ्रॉम देयर यू कैन एक्सपेक्ट क्वेश्चंस इन द एग्जाम. एंड लास्टली थर्ड पार्ट का जो टर्मिनल ब्रांच है, वन ऑफ द इंपॉर्टेंट टर्मिनल ब्रांच, स्फेनोपेलाटाइन आर्टरी, that is also having great clinical significance. Okay, clinical significance in the sense exam point of view, questions are being asked from these two branches. ठीक है. That's why I am mentioning. ऐसा नहीं है कि बाकी branch important नहीं है and it is not supplying. Okay, it is supplying, but questions are being asked from these two branches frequently. Okay, next here you can see the area of distribution. So first part, which areas are being distributed, second part, which areas are being distributed, third part, which areas are being distributed. Okay, now you will think that how it is possible to study all the branches, right? 15 branch है. Okay, how to study, how to remember. So don't worry, exam में direct question नहीं आता है कि write about the maxillary artery. ठीक है, ऐसा question कभी नहीं आता है, never. Okay, अगर क्वेश्चन आया तो फ्रॉम डायरेक्टली 1 or 2 पर्टिकुलर ब्रांचेस अप्लाइड एस्पेक्ट का क्वेश्चन आएगा. ओके, और क्वेश्चन इट में एमसीक्यू में आएगा कि विच मसल इज डिवाइडिंग द मैक्सिलरी आर्टरी इनटू 3 पार्ट्स. ठीक है, लाइक दिस शॉर्ट क्वेश्चन में कम, बट लॉन्ग क्वेश्चन 10 मार्क्स में कि राइट ऑल अबाउट द मैक्सिलरी आर्टरी, ऐसा नहीं आता है. डोंट वरी, यू डोंट हैव टू स्टडी. Just though it is there, that's why I have shown you that these are the branches and these are the areas supplied by the maxillary artery. Okay. Next, anyone have you heard about the pterygoid venous plexus? There is a very interesting fact about the pterygoid venous plexus. ठीक है? There is a very interesting fact about the pterygoid venous plexus. Now, I have seen few students are there inside the classroom sitting and taking nap, or physically they are present, mentally they are not present inside the classroom, thinking of something else, okay? And they are getting bored. So after that means depression of the mandible is taking place. So we have studied in the muscles of mastication. Which muscle helps in the depression of the mandible? Lateral pterygoid muscle. And this pterygoid venous plexus is placed within the lateral pterygoid muscle. Okay, there are some variations, but mostly it is present within the lateral pterygoid muscle. Okay, so whenever you are yawning, whenever you are opening your mouth, your mandible is depressed. At that time, due to the contraction of the muscle, ये जो pterygoid venous plexus है, इसमें से venous return होता है. That means blood which is almost stagnant in that pterygoid venous plexus goes back into the maxillary vein, and it goes into the cavernous sinus also. Okay, so like this, whenever you are doing the yawning, it increases the venous return. Okay, so this is the justification behind the yawning. Anyway, first you have to understand what is the pterygoid venous plexus. This is also important. ठीक है, यहाँ से question आता है. So these are the network of small veins which lie around or within the lateral pterygoid muscle. ठीक है. Now, what are the different locations where this lateral pterygoid venous plexus is pterygoid venous plexus is present? For example, superficial to the lateral pterygoid muscle, deep to the lateral pterygoid, in the lateral pterygoid, partly between the temporalis and lateral pterygoid, and partly between the two pterygoid muscles. These are the areas where this pterygoid venous plexus is present. Okay. Now, क्या होता है? The tributaries of the plexus, any plexus is there, tributaries will be there. Now they are accompanying the maxillary artery. Ultimately, they will accompany the maxillary artery only because here maxillary artery and its branches are present. Okay. Now this plexus, where it will drain into the maxillary vein, which is situated on the posterior aspect of the plexus. तो plexus का posterior end में maxillary vein रहता है. तो ultimately the blood from the plexus will drain into the maxillary vein. Okay, and after that what happens? It drains into the posterior end of the plexus, which unites with the superficial temporal vein to form the retromandibular vein. Now let me show you the diagram. So here you can see this is the location of the pterygoid venous plexus. Okay. Now pterygoid venous plexus is also having some important connections. Okay, and that is having clinical significance. Now what are those connections? Now here you can see the pterygoid venous plexus. Here this is the pterygoid venous plexus. Okay. Now what are the connections? So first of all, with inferior ophthalmic vein through inferior orbital fissure. Inferior ophthalmic vein के साथ connection रहता है. Next with the cavernous venous sinus, as you can see, ये cavernous venous sinus है. ये pterygoid venous plexus through emissary vein it is connected to the cavernous venous sinus. Okay. Next here you can see it is connected to the facial vein. Okay. With facial vein through deep facial vein. Deep facial vein के साथ facial vein connect होता है with the pterygoid venous plexus. So that is also important connection. Now what are the significance of this communication? So facial vein again communicates with the inferior ophthalmic vein. So if there is any infection from facial vein or inferior ophthalmic vein, it can reach the cavernous sinus. And once it reaches the cavernous sinus, there may be thrombosis, which may lead to palsy of the cranial nerves. Why? Because there are so many important nerves, cranial nerves, which are passing through the cavernous venous sinus. Okay, so there is an important clinical significance of the connections, okay, of the pterygoid venous plexus. Now let's discuss about the applied aspect. So though we have started the pterygoid venous plexus, so first we will see the applied aspect of the pterygoid venous plexus. So it is sometimes referred to as peripheral heart. Okay, why? Because during yawning, whenever the mouth is widely open due to the contraction of lateral pterygoid muscle, the stagnant blood from the venous plexus is pumped to the cavernous sinus and into the maxillary vein. Thus, it increases the venous return. Okay. Next, if you want to palpate the muscles of mastication, okay, how you will palpate? For temporalis and masseter, you can palpate it, okay, by requesting the person to clench the teeth. So for that, what you have to do, you will ask the patient either to lie down or sit, okay, and then you have to place your finger on the temporal fossa, okay, and then you will ask the patient to clench the teeth. ठीक है, तो you can feel your own temporalis muscle. यहाँ पे ऐसे fingers रखना है, ठीक है, and clench your teeth. So you can feel the movement of the muscle. ठीक है, that is the palpation of temporalis muscle. ठीक है. Next is the masseter muscle. Masseter muscle के लिए क्या करना है? ये जो cheek है, cheek के lateral aspect में जाना है. Okay, go to the lateral aspect of the cheek, put your fingers and then clench your teeth. You can feel the movement of masseter muscle. ठीक है. So this is how you can feel the or palpate the masseter and temporalis muscle. Next, for medial and lateral pterygoid muscle, it can be tested by requesting the person to move the jaw side to side. Here you cannot palpate the muscles, medial and lateral pterygoid muscle. You can taste it. Why you cannot palpate? Any idea? Other two muscles you can palpate, but these two muscles you cannot palpate. Medial and lateral pterygoid. Why? Other two you can palpate, but this you cannot palpate. You can taste this muscle, whether they are functioning or not. That is because they are situated deep. Masseter and temporalis जो होता है superficially होता है, और medial and lateral pterygoid जो होता है वो deep होता है. तो deep muscle you cannot palpate. Okay, you can taste it. So for that what you have to do, you have to ask the patient to do side to side movement of the jaw. ठीक है, अगर side to side movement ठीक से हो रहा है, that means both the muscles are acting properly. Okay. Next, anyone have you heard about Pterion? Anyone have you heard about Pterion? This one, Pterion. I know you have not heard because you have not studied the skull. So once the skull will be taught, at that time you understand about the Pterion. Now do you remember, I have told you जो maxillary artery है उसका 3 part है. Okay, 4, 5, 6 branches. First part का 4 branches, then 5 and then 6. ठीक है, तो फर्स्ट पार्ट का कौन सा ब्रांच मैंने बोला था इंपॉर्टेंट है? मीडियल मेनिंजियल आर्टरी. वेरी गुड. और लास्ट का स्फेनोपैलेटाइन आर्टरी. तो कैन यू सी द मिडिल मेनिंजियल आर्टरी? कैन यू सी द मिडिल मेनिंजियल आर्टरी? हाँ, तो मिडिल मेनिंजियल आर्टरी का ये, दिस इज द इंटीरियर डिवीजन ऑफ द मिडिल मेनिंजियल आर्टरी. नाउ दिस आर्टरी इज पासिंग behind the pterion, this particular part. Actually pterion is nothing but a H-shaped suture. H-shaped suture. And how it is formed? It is formed between the frontal bone, parietal bone, temporal bone and sphenoidal bone. ठीक है, ये 4 बोन आके इस पॉइंट में अटैच होता है by forming a H-shaped suture, and that point is called as pterion. Just deep to the pterion, which artery is present? Anterior division of the middle meningeal artery is there. Okay, so in road traffic accident or a blow to the side of the head can rupture this artery. ठीक है, ये पार्ट में अगर फ्रैक्चर हुआ, most chances are there this artery may get damaged. Okay, so if artery is getting ruptured, then bleeding will be there. Now such kind of bleeding, the hemorrhage which occurs, that is called as extradural hemorrhage. ये आर्टरी अगर रप्चर हुआ, इसके बाद जो ब्लीडिंग होगा, that is called as extradural hemorrhage. ठीक है, we'll discuss about the type of hemorrhages also in blood supply of brain. ठीक है, in neuro we'll discuss about the blood supply of brain. Don't worry. Different types of hemorrhages. Now if this artery get damaged, okay, then bleeding will be there, and that is called as extradural hemorrhage. Now if the accumulation of blood is much, okay, more blood is being accumulated, then what will happen? It will compress the brain tissue. ठीक है, and sometime क्या होता है, यहाँ पे motor cortex होता है, तो first of all patient will get unconscious, and if huge amount of blood is accumulated, the patient may die also. Okay, So that's why this particular artery and this area is very important. So इससे यहाँ से question आता है applied aspect में. Okay, Pterion. So I'll request everyone who are sitting, enjoying the class, don't enjoy too much. Sometimes note down the important points also. Okay, because you will notice that most of the questions which are being asked, okay, these things are explained in the class. Without explanation or without explaining in the class, no questions will be asked in the exam. Okay, so your motto is to simply enjoy the class to get the attendance. That will not help you. Okay, if you can realize it. Next, okay. Another artery I have mentioned from the last part, that is the sphenopalatine artery. Okay. Now, sphenopalatine artery is also having clinical significance. Sphenopalatine artery is called as artery of epistaxis. Okay, तो ऐसे क्वेश्चन आता है, sphenopalatine artery is called as artery of epistaxis. Epistaxis means nose bleeding. Why? ऐसे क्वेश्चन आता है, ठीक है. Now, for that, lateral wall of the nose and nasal septum will be taken separately, ठीक है. But though it is a part of maxillary artery, that's why I'm mentioning. So if you see sphenopalatine artery is a branch of third part of the maxillary artery. Here you can see the sphenopalatine artery. Now it anastomoses with the neighboring blood vessels. For example, you can see anterior ethmoidal artery, greater palatine artery, and then a arterial anastomotic circle is being formed. Okay, and that is called as Kisselbach's plexus. And the area which is where it is formed, that is called as Little's area. Okay, the area which is formed, that is called as Little's area, and the plexus which is formed, that is called as Kisselbach's plexus. Okay, now if you see the location, it is anterior inferior to the nasal septum. जो nasal septum होता है उसका anterior inferior area में ये Little's area होता है where this is present. Now it is a common site for bleeding for the nose or epistaxis. Okay, that's why it is called as Little's area. Now in that the contribution from this one sphenopalatine artery is more, okay, and this artery is getting damaged. That's why this is called as artery of epistaxis, sphenopalatine artery. Okay, so this is also a very important clinical significance of sphenopalatine artery. Now details you will study in with this one nasal septum and the lateral wall of the nose. Okay, so that's all about the applied importance. So today we have discussed some important topics. For example, muscles of mastication, origin, insertion, nerve supply, actions of the muscles of mastication, and then in detail about the lateral pterygoid muscle. Okay, because that is the key muscle of the infratemporal fossa. Okay, and the most important structure related to this is the maxillary artery. Okay, and the divisions of the maxillary artery along with its branches. Okay, and another important point जहाँ से question आता है, that is the pterygoid venous plexus. ठीक है, कहाँ पे रहता है? Okay, where it is draining and what is the clinical significance? For clinical significance of the pterygoid venous plexus, first this peripheral heart, that is also called as peripheral heart. And next is the communications. तो उसका cavernous sinus के साथ communication रहता है, facial vein के साथ communication होता है, ठीक है? So through that the infection can pass to the cavernous sinus and then various consequences can be there. Okay, so those are the important things which we have discussed today. Okay, and along with that the muscles of mastication part is also over. Thank you.